How are we all going? Let me know when you're all ready. Cameras all good? All right, good afternoon. Thank you all for joining me this afternoon. My name is Jerome Weimar. I'm overseeing the COVID response here in Victoria. And I thought I would just provide a brief update on developments during the course of the day and how we're progressing, in particular with the Holiday Inn quarantine hotel outbreak. I can confirm, as we indicated earlier today, that there are 2 additional cases that have been notified. And as I was walking in here, I've just been notified of a 3rd case. I'll give you some very rough details of the cases that we have notified today. As of yesterday, as you'll recall, we had 8 cases identified with the Holiday Inn quarantine hotel cluster. 3 of those cases were the original arriving family from overseas, and there were 5 cases of transmission within the hotel. We have 2 cases today who are spouses of workers at the Holiday Inn hotel. Those spouses, the workers at the hotel, turned positive yesterday and in the previous day. Their spouses have now tested positive. So cases 9 and 10, as we regard them, so cases 9 and 10, spouses of one of the 2 earlier cases, they have tested positive. They were already isolating as primary close contacts of their partners, and as such, we have at this point no significant concern. It doesn't extend the scope of our investigation. Both partners are being well supported. They have had initial interviews this afternoon. I'm still, of course, getting information as we speak. We are working with both these cases to identify their movements prior to their isolation starting, and of course matching that to the onset of symptoms and the onset of our presumed infectious period. So that work is being done at this point in time. As I stand here now, I don't have any further updates on potential exposure sites, but certainly we believe there will be some additional exposure sites emerging from some of these cases. That work needs to be done over the coming hours. We will update our website and let people know as soon as that information is available. The 3rd case of today, again, I was told this probably about half an hour ago, so information is still coming in, is a staff member at the Holiday Inn. So this is somebody who worked directly in the Holiday Inn hotel. She was already a primary close contact. She tested yesterday and turned positive this afternoon. So in summary, we now have 11 cases associated with the Holiday Inn. 3 are the original family who arrived from overseas, and we now have 8 cases. 6 of those cases we believe were transmissions within the hotel, and 2 of those 8 cases are transmissions within the household, all within primary close contacts. I can also confirm that genomics has come back on cases 5 and 6. We mentioned this, I think, yesterday or the day before. So I'm very pleased to confirm, or not pleased, but I'm aware that the genomics confirms that the cases 5 and 6 have exactly the same variant and typing as cases 1 to 4. They're all of the UK variant, and it is our working assumption, therefore, that all 11 cases associated with the Holiday Inn cluster are all of the UK variant. In terms of exposure sites, again, my thanks to the many hundreds of people who we are now talking to and working with who have been at the exposure sites. We're continuing to work closely with venues. As you know, we rely very heavily on the QR recording system that people fill in at various retail and hospo type services. So my thanks to everybody who is continuing to do that work. We are continuing to work through more information as it comes available. And of course, we have had a number of members of the public come forward and self-identify as having been at those exposure sites. It is so important that people please keep an eye on those exposure sites and let us know if they think they've been at those locations, so they isolate and get tested. I can also confirm we had a very lively community meeting last night with the Sunbury community. Over 300 people joined the Deputy Chief Health Officer and myself. My thanks to them for turning out. It was a very, very good discussion. Upon a discussion at the community meeting, and we looked again at the arrangements within the Sunbury Shopping Centre, particularly with a number of food retail units that are set up in their food court area, really based on a combination of community feedback and our own public health review. We have now decided, out of an abundance of caution, to expand the exposure site to the wider Sunbury Shopping Centre, but at Tier 2. So we are not regarding it as a Tier 1 shopping centre. We think the risk is reasonably low. However, again, out of an abundance of caution, we would ask anybody who is in the Sunbury shopping centre from 3:40 p.m. to 4:30 p.m. on Friday the 5th, we'd ask you to isolate immediately, get tested. As soon as you receive a negative test result, you're free to go, but we do need you to isolate and get tested before you've done so. If you've already been tested in the last few days, of course, please disregard that piece. But for anybody who was at the Sunbury Square shopping centre between 3:40 p.m. and 4:30 p.m, please isolate, get tested, and once you receive a negative test result, you'll be good to go. Apart from that, we're making good progress on contact tracing across the Holiday Inn outbreak. We, of course, have our primary focus, and again, the cases today highlight the importance of these household contacts. So our real focus is on the direct close contacts that our positive cases have had, and the workplace contacts to make sure that we understand what level of transmission took place within the Holiday Inn and the way that is circulated. So we're continuing to focus on those groups in particular. But as I said, we are now dealing with a number of other people coming through the exposure sites, and I'm very pleased for them for doing so. My thanks also to the huge team of contact tracers we've got working across both our local public health units, within our central teams, a number of other organisations that are working on this effort. It is very important that we run these contacts and these exposures to ground quickly. And then finally, before I go to questions, with regard to testing, 22,500 test results from yesterday. We had about another 14,000 or so test results come in during the course of the early morning. So we're seeing a really strong response by communities really across Melbourne. Obviously, a particular focus on the Sunbury area, but also we're seeing some good results or some good testing presence in other parts of the city. And please, I would encourage people to keep coming forward. We are still at an early stage of this Holiday Inn outbreak. We're still trying to get a sense of how far transmission has already occurred, and we need to ensure that we keep running faster than the virus to ensure we run it to ground. At the moment, of course, we launched the Masters drive-through site this morning. That's certainly reduced the queue and waiting times up in the Sunbury area to around 60 minutes. And again, my thanks to people's patience for coming forward to get tested. And that means we now have around 5 or 6 new sites up and running over the last few days in the Sunbury area. I won't read them out unless anybody here would like me to do so. With that, I might just go straight to questions. My information is that she's an assistant manager at the Holiday Inn, but I don't have any other information than that.
So you said there were a primary close contact of another worker.
Yeah.
So which department, I guess, or which department?
Well, so if you recall what we did with the Holiday Inn, so we had an initial group of primary close contacts, particularly people who, the RSOs and others who worked on the 3rd floor, and those were involved in the checkout process. That was our first grab on Sunday night. A day later, we extended that when the authorised officer became positive, and we extended the definition of the primary close contact. So we now have all the staff who worked at the Holiday Inn during that 27th of January to 7th, 8th of February period, who are all in isolation. I have no other information about her direct role or relationship, but she was one of those staff that was locked down.
How long has she been isolating for?
My understanding is that she would have been isolating since Monday, possibly Tuesday, but I can confirm that for you when I have more information on this case. There were a number of different cohorts of staff. I don't have her exact role at this point in time.
So her exposure sites might be quite limited?
I would expect at this point in time, again, the interview is underway, so let us do the work. As we've said a number of times, all the staff in the hotel quarantine program are tested every single day. So every day that she worked, she will have been tested, and every day that she will have worked, she will have returned a negative result, because the first positive result we have for her is from a test she undertook yesterday.
So was she at work? Has she been do you know when she was last at work?
I don't have that information, no.
The spouses that have tested positive, which workers are they connected to? Is it the one that's been shopping in Sunbury?
So there are 2 workers, right? There are 2 food and beverage workers, and these are their spouses. I don't have what I can't tell you, I'm afraid, because again, we are still assembling the details of the information. I can't correlate which one is which. I'm sure my team can, but both the food and beverage workers who worked, both their spouses have now turned positive.
Not the authorised officer's spouse, it's the other 2.
No, my understanding is it's the food and beverage workers. That's right. Simi, I'm afraid I can't tell you. All I've got is that's her job title, and that she's a positive, she's a Holiday Inn, and she was a primary close contact. And literally that was the information I had as I walked in here half an hour ago. No, as I said, the interview is literally being undertaken as we speak. So, we will continue. And we do this with all of our cases. We're keen to let people know how this outbreak is progressing, that clearly it is a very live outbreak. We are, at this stage, we are reassured by the fact that all these positives are emerging within the primary close contact field. That is important to us. And although we are now seeing 2 cases of household transmission, again, this is in the household. This is the closest relationship that you would expect people to have, and therefore, that gives us some confidence that we are still on the track that we need to be on. But this is early days. This is early days in this particular outbreak. We have a lot more work to do today, tonight, and over the coming days. Heavily informed, of course, by a really good testing response, because the more we can see people coming forward, the more information we get, the better our understanding of how far this may have moved.
Do you know what date the family of 3 or Central Index cases were moved out of the Holiday Inn?
So they were moved out of the Holiday Inn on the 4th, and they were transferred to the Medi Hotel on the 4th of February.
What date did they arrive at that hotel? At the Holiday Inn?
Richard, it's not in my notes. I would let me come back to you on that one. I have a date in my mind, but I want to make sure it's accurate, so I'll come back to you on that one.
Where did they fly in from?
I can't confirm that information. You'd have to go to CQV for that.
They're not really coming forth with that information. Isn't it important to understand where this virus is coming from?
So look, our job here and my role here is very clearly around how do we deal with outbreaks that are heading into the community, and how do we ensure that we protect the wider Victorian public. That is what our team is entirely focused on. I just don't have the travel logistics details. That is clearly an issue for our colleagues, and I'm sure they'll share that with you.
Doctors explained today the fact that a nebuliser managed to make its way into the quarantine system. How did that happen? How did you allow that to happen?
So again, and I'm the last one to shirk the blame on these issues. Our colleagues in CQV are working on that, and they have control over the entry process of people coming into the system. And again, they are working on both their existing procedures and what changes they need to make. I believe the Premier and Minister Neville briefed yesterday on some of the changes they're already making to the hotel quarantine system. And let us not forget what we're dealing with here, as we've dealt with last week and as a number of other states are dealing with, is this UK variant that is starting to become a real challenge to our hotel quarantine system. We don't shy away from that. This is causing us a significant set of challenges. There are clearly a range of views around the impact of nebulizers, but our major concern is we now have 11 cases, 8 of which are in the community, either in the hotel quarantine workforce or in the wider community, that are now likely to be of the UK variant. We've genomically confirmed that 3 of them are of the UK variant. I suspect the other ones will be as well. So that is our primary concern. How that came in, how that was moved around is, I'm afraid, not a matter for me. What is a matter for me is how we ensure that through contact tracing and testing and a community response, we get this to ground as quickly as we can.
Do you have confidence the system is safe moving forward, though? There's not other cracks that we don't know about?
Oh, absolutely. Look, I think if you look at the amount of energy, attention, resourcing that is going into a hotel quarantine system, we have a fantastic, capable team that's running our hotel quarantine system. I have absolutely every confidence in the way they're approaching it, and we've always known, and as we've always known, that this risk is real and this risk is something that can happen. That is why, as I've said a number of times, the 3,000 men and women who work in a hotel quarantine system are very much on the front line, and that is why our contact tracing and support system is right there behind them, so that when we see these cases, we can deal with it quickly.
Speaking of that front line, though, today we've been sent photos of staff in quarantine hotel workers who don't have masks or gloves on. What's your response to that?
Look, I would be disappointed is probably a gentle word to use if that would be the case. I'm sure that if that were to be the case, that there'll be very swift action being taken by my colleagues to deal with that. That is, we have very clear expectations of the absolutely highest standards that we can possibly get. There were discussions taking place over the last few days about the next stage we may need to go to deal with the UK variant in hotel quarantine, and that is what the team there is entirely focused on.
How many people are now considered close contacts, primary contacts, and how many people are isolating?
So I don't have the full numbers at the moment for the Holiday Inn outbreak, and of course, as we're seeing exposure site data coming through, those numbers will grow. Happy to give you an update on that tomorrow morning.
Is it in the thousands?
No, it's not in the thousands. We are currently, the last set of numbers I saw were around the 400-500 number in terms of the number of people coming out of exposure sites, the number of people who are in the workplace setting at the hotel, and of course the residents that were in the Holiday Inn hotel. And again, Richard, very happy to give you a good rundown on those numbers tomorrow morning.
On the summary community meeting that you had, have
No, I didn't head out to Sunbury. I'm afraid I've sat up the road on a Zoom call along with a number of colleagues, and everybody dialed in. But look, we've done community meetings all the way through our major outbreaks over the last 4 or 5 months or so. We've found them to be, very good ways to get information out to people around what is happening in their location, what is happening in the nature of the particular outbreak, how do the exposure sites work, but also to give people some reassurance on what they can do to come forward. So. Yeah, look, I think we have the largest number of exposure sites of this entire outbreak in the Sunbury area. So there's a huge focus on ensuring that, this isn't something happening to other people. This is something happening to, Melburnians who are working in the hotel quarantine system. This is Melburnians whose partner work in the hotel quarantine system, and it's, we have 14 or so exposure sites in the Melbourne area. So this is relevant to all of us, and that's why, it's very important that we don't just see this as a hotel quarantine challenge. This is also an issue for local communities, and that's why we want to reach out to them.
And of the, I think you said 34, maybe 38,000 texts that went out to
Yep.
people in that area yesterday, are you happy with the amount of people that turned up?
Yeah, look, we saw a really solid response yesterday. Look, and we've seen it in, some of the waiting times we saw yesterday. They reduced a little bit today. So I think we're seeing a really strong response. 22,500 tests during the course of yesterday. A good load in the labs this morning, similar to what we saw last week in the southeast of Melbourne. So look, we're incredibly grateful to the Victorian community and to Melburnians for recognising this is another one of those moments where we have to pay attention. It's another one of those moments where we have to work together to go and deal with it, and I'm very grateful for everybody who's doing just that.
Given how rapidly this cluster has spread in what is supposed to be a controlled environment and hotel quarantine, how concerned are you about the potential for it to have spread further afield in the community beyond people who are quarantined?
Look, I think at this point, I'd say, we're alert but not alarmed. I mean, we are right on top of this one. So we are finding. Bear in mind, the design around this is that we're finding people who tested negative only 1, 2, 3 days ago. So we have a really good understanding of the workers at the hotel quarantine system. At what point, what's the earliest possible point that could have turned infectious? If I go back to Black Rock, we were dealing with cases that were 7, 10 days old. They'd been circulating for a number of days in the community. So we're right on the heels of this one, which is what we were designed to do. So that gives me a lot more confidence that we know that we've got the approach right to dealing with this. What is more challenging in this one is it's the UK variant. So we don't yet know how easily it transmits when you get into the second, third generation of people catching it. So that's going to be the challenge for us now and over the coming days, which is, as we see it, starting to move and transmit in households. We're confident we've got those people locked down. We're confident people are doing the right thing, but we need to see how quickly it's going to move on from here. And that's going to be, it's an important moment. This will be the first time we've had to deal with this UK variant outside of hotel quarantine. That's why we designed our systems the way we have. That's why we're working as hard as we do. And that's, bluntly why we reintroduced the mask restriction, 7, 8 days ago, because we want to ensure that, we do take sensible measures as a community to slow the transmission of this thing whilst we go so hard at tracking all these people down.
We did see those.
Sorry, sir. Yeah. Yeah. I'm afraid I wasn't at that meeting. I did speak to Emma today, and Emma and I speak very often, but I'm not aware of whether they've met or where they've landed on that.
We did see the queues significantly shorter today in Sunbury. Obviously, you said a great turnout yesterday. Is there still a sort of that call to arms for this to continue over the coming days?
Absolutely. Look, I think one of the reasons that the queues went down is we opened up a pretty big drive-through site at the old Masters car park, and that made a almost immediate difference, which is what it was designed to do. But no, look, I think this is by no means over. We are still in the opening quarter of the Holiday Inn outbreak, I'm afraid. We've got a lot more work to do, and although we're standing here saying these are still within the primary close contact field, we have a significant number of primary close contacts, and we've got a lot of work to do to really make sure we pull this one up. So we've been here before. We were here on the Grand Hyatt only a week ago. We've been here with Black Rock. We've been here in 2020. So we have an experienced, capable team that's driving hard at this, but this is a bit different. It's a UK variant. We don't yet know everything about it, and we have to be on our guard to make sure we keep running it.
With the cases, can you
Sorry,
provide details on gender and age and what suburb they live in?
Yeah, I can do when I have it, but I don't have it yet. I can confirm that the spouses are both men, and I can confirm that the assistant manager is a female. That's all the information I have at the moment.
We've got a Melbourne family currently in hotel quarantine in Adelaide because the daughter was exposed at an osteo clinic on Friday.
Yep.
They flew to Adelaide unaware on Saturday to visit family. Now they've been caught up in 14 days quarantine there. They say they're not sure whether or not she's actually even a primary contact. She wasn't there at the same time as the confirmed case. And that clinic itself wasn't listed on the exposure sites. Can you just sort of give some context around how this has happened?
So there was a positive case who went to an osteo clinic, as you say. I don't have the dates in front of me, but who visited an osteo clinic. Because it was a private venue with private clients, we contacted all the private clients and all the staff who worked at the osteo clinic on that time window, and they were all asked, or they were all told they were primary close contacts. They were asked to isolate, told to isolate, and to go and get tested. I'm not familiar, and as I think I've made clear over the months, I really do not want to get into a dialogue via the media on individual cases. I think it's grossly unfair to the individuals concerned. We're pleased that the family's being supported in Adelaide to do the right thing. When you're a primary close contact, it is very important that you do isolate and you do get tested, and that you get the support to do so. And we take every effort to do just that.
Are there a large number of sites though that never make it onto that public list? Because that's been the shock, I suppose, that they've looked at that website, had no idea that they were in any risk or concern at all, and then they get a phone call out of the blue. Yeah, so
the position we take on this is that when there are sites where there is no public access. So if I take a simplest example, if people are coming to my house for dinner, that is not a public site. It is then a responsibility of me to go and chase after the people who came to my house and to ensure that those primary contacts are dealt with. We would take the same view with a private osteo clinic that said these are private appointments. We have the osteo has a register of the clients that they've served and their contact details, and we get after them immediately to ensure that they're isolating. So we would rely on that system. We don't think it's reasonable or there's any additional benefit to publicising private venues because actually we're not asking people to then self-identify and come forward and say, well, I was there the day before, or I was there the day after. That's actually not helpful in terms of how we run this particular response. If there's been a misunderstanding, miscommunication, we'll deal with that outside of a press conference.
Is one of the last cases related to Camberwell Grammar?
There is certainly in one of the interviews, one of the spouses, I believe, has had some contact with Camberwell Grammar. That information is still emerging, and I think we're identifying a number of primary close contacts. At this stage, that is still a live investigation, and we're working with the school to ensure we understand exactly the nature of the exposure. At this point in time, I'm not naming it as an exposure site. At this point in time, I'm not concerned. We will continue the investigation over the coming hours, and we'll advise the school and the school community if, and I stress if, we need to take any actions.
I've got a question that may come to similar answer to a question that Steph asked earlier.
Okay.
I just want to put it to you so I put the scenario to you. There's
Yep.
someone who's come out today and said they were dropping a care package to the Park Royal.
Mm-hmm.
They went up and they were allowed up and ended up in a lift with someone in full PPE.
Yeah.
Should that be happening? Do the staff need a refresher or about?
So again, I don't know the details of. I've heard of the inquiry that's been made. My understanding of the Park Royal situation is there was somebody went to the entrance of the Park Royal Hotel to drop off a package and was met by a colleague from the ADF who dealt with the situation. The entrance of the Park Royal Hotel is on the 4th floor. Beyond that, I don't know much more about the geographics of it. But if there's a particular inquiry, happy to deal with it.
Just on that, do people get approval to deliver goods to their friends?
No, they don't. There are, again, this is probably a question for CQV, who'll be able to advise exactly on the procedure that they use and what the booking system is. So I can give you only a very general response. There are very tight controls about who can come in and out of a hotel quarantine hotel. It is only for the entire hotel is dedicated to hotel quarantine operations. All the staff employed directly by us and our direct agencies are managed to a very high standard, and there are clear protocols for who can come in and come out, and very strong records are kept about who's coming in and out. I think we've seen in previous, when we were dealing with Grand Hyatt last week, we keep registers of every single Uber Eats delivery that's made to the front door of that building. That is still in the green zone as a CQV toolkit, so it's not a red zone or exposure zone. So all those records are kept and managed, and in the case of these outbreaks, that's what we follow up. But again, any detailed questions about how that works and how that's arranged, I'm afraid you need to talk to my colleagues at CQV.
That particular case would be out of the ordinary?
Yeah, I mean, the idea of somebody coming in and out of the hotel, and I don't think that is a scenario that I would, at this point, I have no evidence that scenario has occurred. So I think you're going to have to talk to CQV to see if there's a specific question or evidence that something out of the ordinary has happened. I'd ask you to talk to CQV about what's going on there.
Do you have an update on the ICU?
No, I'm afraid I don't. No, I'm afraid I don't. I checked in, I think, yesterday. I don't believe the situation's changed. And of course, look, I think, and thank you for the question. What we often lose sight of, and it's easy to lose sight of, is of course that you have now 17 people who still have active coronavirus in the state, and we have 3 more people who've got active coronavirus here today. It is a hugely threatening and dangerous and terrifying condition for people to have, and our sympathy and all of our hearts go out to people, but also all of the support we want to provide to people to make sure that they recover safely and well, and that we can get beyond having this again in our community.
And the conditions of the 17 active cases, so they all well, are they showing symptoms?
Yes, so with the exception, of course, of the gentleman who I believe is still in the ICU. I believe at this point in time, there are some of these 3 are symptomatic. I believe 1 at the moment is symptomatic as far as I'm aware, but they're all being cared for, and at the moment are all either in a Medi hotel or isolating at home. Okay. Any other questions? No? Thank you very much indeed. See you all soon. Thank you.